Yes, a very good morning, our viewers of Issues at Hand. We are here yet again in a new week to discuss issues that are making headlines as well as issues that impact our lives directly. My name is Carola Noamani and I'm here to take you through this segment. Now today we are going to be discussing a very, very interesting topic. But before I go there, I'd like to remind you that Protea Hotel by Marriott is the place to be in case you are looking for that luxurious life and where to spend your hard-earned money. I'm talking about gym, sauna, health club, as well as very, very, very affordable meals and rooms in case you want to spend a night. That is Protea Hotel by Marriott. But to get back to our topic today, we are going to be looking at a very, very, very controversial issue when it comes to issues of money. I'm talking about the pre-medical interns. They have been having strikes here and there. We saw 3 weeks back that they asked the government to cover their expenses, or else they would them and their colleagues who are already paid will strike again. And we saw that because of the unseriousness or the let me call it unseriousness of the government to put a conclusion to this issue, we have had a number of challenges coming in from that side. But in studio today with me is, of course, Dr. Ainematsiko, not Ainematsiko Wycliff, and we will be talking about the pre-medical interns deeply. And I'd like him to first introduce himself, then we go ahead. You're welcome.
Thank you so much. My name is Wycliff Ainematsiko. I'm a pre-medical intern. I've been one of the people who have been on the front line of this struggle. And maybe what I can say is that I'm one of the frustrated, the 2,000 medical interns who are still down 1 year without a license and without deployment, even when they have their transcripts from the university. Yes.
Let's start from right there where you said some people have licenses. We would like to understand what is the procedure of becoming a medical intern. Is it that when you're in medical school, immediately after, you're a medical intern, or is there something that they give you to show that this one is your permit?
Yeah, there are some protocols we follow and procedures. I think before I answer your question, I want to clarify more. Medical interns are not students. These are people who have already graduated from their universities. And for us as degree medical students, we are having bachelors in nursing science, we are having pharmacists, we are having doctors, we are having dental surgeons, and we are having midwives. So when you complete your university, even after graduating, you will never get that practicing license. So it is mandatory by law to apply for internship. The ministry calls for application via the different councils for those cadres. The nursing and midwifery, then we have the Pharmacy Society Uganda for pharmacists, and we have the Uganda Medical and Dental Practitioners Council for doctors. So you apply and you get what we call a temporary license. That temporary license, it is valid for 1 year. So it's the one that helps you to practice for medical internship. So that medical internship, it gives you more skills. As a country, it strengthens. It strengthens the profession because you are exposed to more cases, you have more experience and so on. So by the time you get your practicing license, to move away, at least you have got enough experience to work on the life of someone.
Okay.
Yes.
Just a brief history. The government, through President Museveni, gave a directive and said Ministry of Finance should find the money to pay these medical practitioners. And after this directive, we saw Dr. Twine coming out to say, yes, the money will be found. But for now, since there is no money, can you give them time as they prepare where the funds are coming from? But can you be working as they do that? What is stopping medical interns from working without the money? Yet, you people are supposed to, this is a calling, you're supposed to save people's lives.
To give a brief history, we are supposed to be deployed by 3rd April. When you count the months now, we are coming to 3 months.
True.
Yes. After that, after 3rd of April, Ministry of Health released an information to us and told us to hold on for 2 weeks. They are sorting out some issues. Up to now, issues are not yet sorted. they gave us a complaint that the government chopped their budget. Based on the budget they've been getting last year, that they reduced it. So they are unable to deploy medical interns and pay them, because these medical interns, why are they supposed to be paid? Because these are the people who work 24/7. Regardless of whom you are, when you are in your internship, you work in a regional referral hospital and referral hospitals. Mulago, you see them Mulago, you see them in Naguru, you see them in regional referral, and you can't even determine your placement. For you just apply, and the ministry will be the one to distribute you. They will say that maybe Karen go to Gulu, Wycliff go to Moroto, and so on. So in due course, that allowance they give you, it's the one that to run your activities of daily living. You have to eat, you have to sleep, rent, airtime, and so on. So Minister of Health came up and told us that they didn't give them enough money, so they have less budget to facilitate us. So they've been in different engagements up to now.
Unending engagements.
Unending engagements. So previously, I think like 3 weeks ago, following that industrial action that was made by the pre-medical interns, the president gave a directive, and the cabinet also approved that these medical interns, they are resourceful to the country. So get money and deploy them. So from there, even we had got some hopes knowing that anytime we shall be deployed. Because imagine you've been seated at home for 1 year, you can't get an official job, because you don't have that valid practicing license. So we are a bit somehow relieved. But now, what again frustrated us more, I think last week we had an online meeting with the permanent secretary, Dr. Diana Atwine, and she addressed us well. But what followed, it even made us cry more tears.
What do you mean when you say what followed? First of all, what was in the meeting, online meeting that you had with Dr. Diana Atwine? She
called for a meeting. We thought that maybe it was something to be positive, since following the directive of the president and the engagements they have been going through. So, but she told us that for them, they haven't received the commitment that the Ministry of Finance is be getting money. That is first and foremost. Previously, we had gone to the Ministry of Finance, and they told us they haven't received the cabinet meetings. I mean the cabinet minutes of the other meetings when the president gave a directive. Yes. So they were still waiting for them. So from there and then they went for, is it Chankwanzi? Those stuff.
Retreat.
So after that, when we went back, after that, it's when she came and addressed us. And she told us that for them, they haven't received money. But now the number of medical interns is increasing because some universities now they are completing. Another group is now down there. So for them to reduce on the number, so those who can manage to facilitate their own internship should apply and go to those hospitals. They pay for their rent, they pay for food, they pay for what? Everything. And I want to tell you that in Uganda, some of us we've studied on the mercy of the Lord to finish that.
Very true.
Not even 7% can manage that. So she even mentioned it well that the rich can apply. Then the poor will have to wait. This one I can clarify it because I was in that meeting. She said those words.
She said the rich
the rich who can manage go ahead and apply.
And she even said the poor. She used those words.
The poor who can't, you will have to wait till when? We don't know. She said because we don't know until the government thinks about you. So just imagine again waiting for 1 more year because you don't have enough money to facilitate yourself in 1 year. So now, for us, we had no choice left, and that's why last week you saw again another industry action.
Yes.
Yeah.
So let's begin from the words of Dr. Diana. She said the rich should go ahead and organize themselves and get ready for medical internship.
Exactly.
As the people who can't afford, wait for maybe next year. We are hoping if everything goes right. But I'd like to understand, if you don't do medical internship and you go ahead and maybe get a job as a doctor in a private sector, does this affect you in any way? Why are you waiting for only medical internship? Why are you waiting for that money from government? Can't doctors find their own way through the
What allows you to apply or what they consider in our medical professions, it is a valid practicing license.
Yes.
And you can only get it after that
medical
internship. Yes.
So it is that important.
When actually after that medical internship, they verified your skills that you can practice as a doctor,
Yes.
as a nurse, as a pharmacist. We are meaning the degree level, Yes. That's when you get that valid practicing license. Otherwise, maybe unless your dad is also a rich person and is having a hospital, you can work there, but illegally, because you don't have that license. Yes.
So we are looking at underprivileged people. You said over 2,000 medical students are at home.
We are
Medical interns?
1,001
Okay,
medical
so
interns.
how do you come to now fight for their rights? In what capacity? Or of these 2,000, how do you group yourselves to know that this time around these are our leaders, they're going to fight for us? Because it seems some of you are quiet while some of you are pushing this thing.
Yeah, of course. We've been having different WhatsApp groups where we talk, and we've been united actually, I think, by the start of this year, because after your medical school, there is that leadership we call Federation of Uganda Medical Interns. It is a federation that brings all the medical interns, which fights for our rights.
Government entity?
No.
Private?
It is a private. It is just for the medical interns, Federation of Uganda Medical Interns. So it's the one that covers almost all the medical interns. So we have our different WhatsApp groups and all those interns from different universities, whether Bustima, whether Bugema University, whether Makerere, whether Mbarara University, Kabale, and so on. So we are always there interacting.
So all those universities have representatives on that federation?
We have different representatives here, yes. So we are always in touch.
Okay.
Yeah.
Have you engaged with some government officials to get quick help? Have you looked for a hand from some of these government officials to see whether they can help you push your initiative forward and get some answers?
You know, one of the things in Uganda that disappoints is also this government. Yeah, we've been having different engagements, starting from the parliament. From the speaker herself, we went in her office. And she even called for a motion. They discussed about our issues. And in the parliament, they approved that medical interns are resourceful. Get money. Yes. So you add ministry more 80 billions.
80 billion?
Yeah. I can assure you that medical interns, 1,901, they only need 54 billion for 1 year.
54 billion.
For their allowances in 1 year, in 12 months. Then we also have another group of senior housing officers, and we have our associate consultants. They are also in our industrial action before, but some of them were slightly sorted, so they are still waiting to be fully sorted. Unlike for us, the medical interns. So when you make a total, you make 80 billions. So the government approved and say that, the parliament say that you give them 80 billions. And, you know, they even directed the Minister of Finance. So they even went in the cabinet meeting because we had engaged them. So that's when the president directed. So after that, we made a follow-up. My dear, I can tell you that we had never rested. Every week we are moving up and down in those offices and so on.
But
yes, we went to the Ministry of Finance. They told us they don't have minutes and so on. So we waited for those minutes. But right now I can tell you that they have those minutes. But recently, after that meeting with the Dr. Diana Twine, you know, we had a general meeting with the Uganda Medical Association. That is an umbrella that governs all the doctors within the country. And they told us that in the meeting they had with public service, that the Minister of Public Service told them, and she even gave Minister of Health 9 days to deploy the medical interns. It was Saturday. Because the cabinet committed that they should look for that money. Even the Minister of Finance himself, he said, let me go and look for the money. So he always say that, as you know, these medical interns are always paid quarterly, every after 3 months. Why don't you deploy them? And for us, you give us the role of looking for that money. So that's so far where we are at the moment.
Now, 54 billion, or let me make it 80 billion in total that you've
Yes.
mentioned, is supposed to be given to medical interns per year, right?
Per year.
And we are looking at government's revision of 2023-2024 financial year budget, cutting from, or being risen from 51 trillion Uganda shillings to 52 trillion Ugandan shillings. So of that 52 trillion Uganda shillings that has to run a country, really, you want government to get 80 billion of that money and give it to medical interns. Why don't you guys run on a low budget? Because I'm seeing 80 billion as a lot of money. I don't know if you can break it down for us, or if you can support this motion that I'm saying of reducing this money, maybe by half.
I can talk about the 54 billions because it's for the medical interns, but 1,901 people, almost nearly 2,000. When you look at that 54 billion, and for the full year, you see that it may not be so much money. I can tell you that we are getting half of the salary of our seniors, but they even tax that allowance. I don't know. I'm not so much well in economics and those finances and so on, but now the allowance that is given to us is also taxed 30%.
How much is every one of you supposed to get? Let's start from there.
A doctor, of course, gets 5M. Now we are supposed to be getting 2.5. Okay. That's the medical intern.
2.5 million per 3 months, you said? Or per month?
No, per month.
Okay.
Per month. Then a pharmacist is getting also 5M. They're supposed to be getting 2.5, but now they're getting 2. I'm meaning interns.
So there are some of these people who are getting 2 million, even as we speak.
As we speak. Yes, it should be the. I don't know whether you're getting me. I'm
getting you, but I'm saying of this 2 million, can't you go home with 1M so that this other 1 million is given to your colleague?
Now this money came.
We counter the problem.
This money came as a directive from the president also. Initially, we are getting only 750,000. But now imagine your son has been dropped from Kamwenge, from Masaka to Kalamoja to Moroto. So you can see the expenses, even the rent, even the what, and eating. The 700 can't even manage. Yes, can't manage him or her in that full month.
But you people,
so they gave a directive that we should get half of our seniors.
2.5.
Yes. But now, even if you weigh that allowance we are getting and the work that is being done, it's really more than enough.
But you see, as a developing country in Uganda, we have to look for solutions that are that work for us. Exactly. For example, other professions, most of them actually earn very little money. I'm not saying that we should degrade doctors too, but can we look at a person who survives on 600,000 shillings, for example, in other fields? I'm not saying this is what you should earn every time, but can't we do that so that you people can start off? Then as government looks for the money, like Dr. Atwine said, then they'll cover it up. Have you thought about taking, for example, if you're supposed to take 2.5 million home, have you thought about taking 1 million home so that your colleague can go do the intern? Then at the end of 1 year, you revise this money, you revise the terms and conditions.
You know, the problem with the government is one. For us, we may not give them that suggestion. But now, what if they come? They had never engaged us on issues dealing with salaries. Whatever they tell us, there is no money, and we can't deploy. Those are the only answers. But if they come and they tell us there is no money, but what if we do this and this and this? What matters? We only need to get our licenses. It's what matters, and it's what is making us cry. The years are just going. When we are down, we are not doing anything.
Okay.
So such kind of engagements, let them bring, and we go on a table and we sit, we discuss on that.
So you can actually discuss and agree that you go with 1 million as long as all of you do your internship.
Personally, I don't know what others may say, but when they bring such suggestions, we sit on a table and you see what we can do about it.
So even the discussions are failing, is what you're saying?
It's because such kind of the discussion, they haven't even suggested them to us. For us, what we are fighting for is our deployment, and with the payment. But now when you tell us that you won't even give us a single coin, the rich should apply, really seriously, you see that you are even frustrating us more and more.
Lastly, before we take a short break, this issue of non-payment or of non-deployment of interns, has it just started in the recent years? For example, 3 weeks back that you striked, I remember even, I think a month back, you were in the news for the same reasons. Has it just started this year, or has it been an issue, a recurring issue?
It is a recurring issue. It's not something new in Uganda, not only in Uganda, but even in Kenya. So I don't know what happened to African countries, but almost every year, these medical interns have to strike, and over similar reasons. So it came to our mind that sometimes Ministry of Health, we are not a priority to Ministry of Health. Neither the government is taking the health as a priority. That's why almost every year they are striking, and over the similar reasons. From 2016 up to now, almost every year, they are striking.
So from 2016, you want to tell us that people have not gone on. What solutions have you brought as interns? You want to tell me that people have not gone on internship for that long? Or people have looked for other ways through? What are those ways?
No, and every year there is a cohort that come out. And sometimes if they strike over this, you find that maybe the government works upon it, and now they go back and they work for that 1 year without any disturbance, they finish. Right now, those who were there, the cohort of 2021, 2022, they finished in March. They got their licenses. Now in hospitals, we don't have medical interns. Yet we do more than 70% of the work. Are you aware of it, that now the workload is too heavy for our seniors, doctors, and now patients are seriously suffering?
That's what I was asking you, that you people are vessels. It is a calling for you to go to work. So if you are staying home because of not being paid 2.5 million Uganda shillings and people are dying, you as people who studied medicine, don't you feel somehow that you are in the wrong profession?
We are in the wrong profession.
Because
I don't think
doctors are supposed to save lives at all costs.
At all costs. But how will you save a life when you've slept, when you're hungry? When you are too stressed? Will you really recognize and you diagnose really a disease and you work upon it when you've spent 2 days when you haven't eaten?
No, I don't think
Let's think about that also.
All right, I think we're going to take the discussion to solutions mostly and understand exactly what Dr. Wycliff thinks that should be done. What should the government do? Who is supposed to work on these particular medical interns? And especially, my biggest question is, where is the money going to come from? Stay with us as we look at the discussion when we come back. Okay, it is a very beautiful discussion. We are trying to dissect and find out exactly what to do for the medical interns and what they are asking government to do for them. Now, these are people who help us a lot when it comes to, of course, patients in the hospitals. We are seeing patients in government hospitals increase by the day, but there was a report that the manpower to handle what they need is very, very low. There is no manpower. When I'm talking about manpower, I mean doctors and professionals to handle these issues, and we are facing a very, very hard time when it comes to, you go to a hospital, for example, a government hospital, and you wait for 3 hours to see a medical practitioner or to get help of any kind. And we are trying to see why are the 2,000 medics of this year, medical interns, still at home? What can be done to exactly solve this issue? I'm in studio with Dr. Wycliff, and we are trying to find all these solutions. I would want to start with the question of the proposals. When you went to government, when you striked in the media, when you stood up for yourselves, was there any proposal given to you? Was there any agreement you had with these ministries? Because we are seeing 3 ministries getting mixed into this whole picture. We have the Ministry of Public Service, which makes sure that all government staff are cared for. We have the Ministry of Health, where you guys fall as a profession, under the medical profession. And we have Ministry of Finance that is supposed to look for the funds to care for your problem. Have you got any written agreement from any of these 3 ministries to guide you on what steps are next?
The answer is no. We haven't got that written commitment or agreement. You know, what is now on ground, I can tell you that they are playing us a ball. Ministry of Public Service is not too much in this. I can first exclude it. But now the main ministries are the Ministry of Health and Ministry of Finance, Economic Planning, and so on. Ministry of Health tells us they haven't got a written commitment from the Ministry of Finance that they will be given that money. Or the Ministry of Finance is soon getting that money. Therefore, they can't deploy us. following the directive of the president, they told them, look for money and deploy these medical interns because they are resourceful to the nation. Now, medical interns, it is worldwide, in fact. Every country has that program. They pay their medical interns. They do that internship. Even in developed countries like US and so on, they do it for more 2 years, and they even have contracts and so on. Even they are paid highly. But the fact that they are also developed countries, and for us we are developing, that's why our pay is still low. And the fact that we are still developing shouldn't be the reason for frustrating us more, for not prioritizing us. So now the Ministry of Health coming up with such unlawful policies to deploy half, the rich, then the other poor will suffer. It's totally unlawful, and it's really not good at all. Dr. Diana Twini and Dr. Ruth Acheng, it came to our mind that they are also not prioritizing us. Why? As a ministry, it is our mother ministry. I don't think if they do random engagements with the Ministry of Finance, I don't think they can't get that written commitment. But now, this day, you may have some good hopes. Another day, then the ministry calls for a final meeting, and they even frustrate you more and more. Even that suggestion, that policy that Diana Twine brought, it is unlawful. It is against the internship policy that we are following.
If you had this written agreement, say by tomorrow, and you have received it and they've said the agreement is on paper, now what's left is looking for the money, what would it change? If you only have a paper written, what would it change?
Right now, we are not trusting anyone because anyone is now proving to be a liar. It's what I can tell you. Because even when they tell you that we are waiting for the cabinet minutes, after getting them, there is nothing that changes. Even when the ministry tell you that we are waiting for the written commitment from the Ministry of Finance, we don't know. We don't think that even when they get, like now we are losing hopes in each and everything.
So the written agreement is not important.
Right now they are telling us it's what they are waiting for because our program is already set. The list is already there. They had deployed all of us on the list, but they haven't released it. So we have hopes that if they get that written commitment from the Ministry of Finance, it's all about releasing that list, and you find Wycliff is in Moloto, this one is in this. Then they give us a day of reporting. We just go and report that internship. 1 year, you finish. That's all that is needed right now.
Do they deploy randomly? What is the deployment criteria?
The criteria for the deployment.
And can they first deploy maybe where it's going to cost them less? Say, let's first deploy in Kampala before we go to Moroto, because now that's more money.
No,
do you think that would be
it may not be more money. No. They just deploy you randomly. You only apply and they get a list of graduates from Makerere, from
all universities.
UCU, from what. Then I don't know how they deploy us, but you find yourself in Gulu, this one, and you have to report on the same day. The program starts on the same day and it ends on the same day. Okay. Yeah. All right. Even if you are in Moloto, still you are earning the same allowance with someone in Mulago, with someone in Kabale. So it is a similar program, and there is no way how it can be costly here and less costly there. Okay.
Looking at the budget, since we are running on a 52 trillion budget as Uganda, do you think some ministries are getting money that could be sacrificed for the Ministry of Health to cover medical practitioners? Do you think some money is going to things that are maybe not important and not priority?
Yeah, that is a very good question, actually. As a priority, of course, now those ministries, the Ministry of Finance, Economic Planning should sit. And at least even if they deduct some, because from the different sessions of the parliament I've watched is that even some ministries use money and they even take it back to the Ministry of Finance. So it came into our mind that we who are not priority yet in real terms we should be, let them sit, and maybe if they say that Ministry of Defense, we are not at war right now, at least let them deduct like 10 billion and so on. Ministry of this, like 5 billion. At least they can make that 50 billion, and then they add. It is something that may be somehow easy, but too hard to be made. These are some of the proposals that were made by different MPs, different legislators in the parliament, but a deaf ear was given to them.
Okay.
So right now, very many legislators, they now know what medical intern is. And every day we are seeing them in different engagements with us on Twitter. They are also advocating for us. But who decides in Uganda? We know him is the big man, His Excellency. Even after giving the directive, ministry is also defying it. We are not sure whether they're playing us a ball. Down Minister of Health, down Minister of Finance. We are just not sure. Only what we've got is just mistrust from those ministries.
What if there is a situation where government comes out and says, for this year, the money has really, really failed? What next for you as medical interns? Because you are not going to blame Dr. Diana when you've sat home 2 years. You have to look for what next in your future as a medical practitioner. So as you people who are coming out, to struggle for this, to be heard by these ministries, what is the plan in case this money somehow
But the money can't fail because they've been financing us in the previous years.
Because we are seeing 1 month back you striked.
Exactly.
Last week, the same thing. Since 2016, you said. What if for this year, the case becomes very, very bad, that the money is not gotten at the right time or even not gotten anyhow? So what would
No, you
be
can't
the next?
lie to us that money is not good. That is totally wrong, and we cannot believe in that.
Can you report to the courts of law? Do you think you have any case against government if things go that way?
Of course, that one is the next step. And I can assure you that we are having more than enough evidences to do that, because whatever policy they are bringing in, we are having our rules and regulations that guide us as medical interns. So they are totally against them. They were made by the Ministry of Health some years back. And every doctor that you are seeing, and actually they had to do that medical internship to be where they are. And it shaped them into good people. That's why they are managing the lives of the Ugandan people. So also as a government, they have to think about the son and the daughter of the peasant down who had a dream of becoming a doctor, of becoming a pharmacist. And right now, the dream is failing. Because now I can assure you that if now they don't get money, sincerely speaking, there are some people who will never do this medical internship. Some have started on government scholarships. Some have started on different scholarships, and right now they no longer get allowance. You find that even the family can't raise even 300 per month to finance them. So we are just speaking on the voice of an average person, of a common person. Don't look at the son of a minister and you compare him with the son of peasant down. Yes, so let the government, it should really have mercy, and the people responsible for the planning. I don't think that one can fail. No.
Okay.
In the State House, there's 265 billion per year, that budget. In 2013, it was only 63 billions. You know, government is spending a lot of money in things that they are not priorities. A lot of money is lost in corruption almost every day. People are robbing a lot of money.
Of this? What evidence
Yeah,
do you
we
have?
saw the incidents of iron sheets even by the big people in the government. We saw it. Even for the frustrated people in Kalamoja and so on. So even the victims, you know, there is a lot that is going through into this country that I think there is something better that it needs to be done.
Okay.
A priority should be a priority.
Just before we look at maybe the state of the hospitals currently, let's first look at rules that govern you, maybe from the constitution or something, but what are the rules that govern medical interns, and what do you base on to move forward with your work?
Yeah, I may not clearly tell you each and everything, but the main point is that these medical interns, they have to be deployed after their school or after their university, without segregation. So the issue of the rich going and the poor, it's totally against this. Also, they have to be catered for. So what you are telling me that now there is no money, so if you have to do it on your own case, so it is also against that. Because those who made those rules, they automatically knew what we go through for 1 year. 24/7. You've got a critical condition at 1, you wake up, you're sleeping near the hospital sometimes. and you have to be there. At 8, you have to be there, up to 6. You have to eat. Sometimes we lack even time to eat. We are doing more than 70% of the work. So sincerely speaking, even if you sit and you analyze whatever work we are doing, and even how much the negativity they are giving us, it's totally not good at all.
All right. Let us look at the state of the hospitals currently. We have government hospitals that, of course, are supposed to be catered for by the doctors that are posted there by government, also supposed to be paid by government. Currently, there are no medical interns, so there are no people to do the easy stuff around the hospital.
Exactly.
So what is the state of hospitals currently?
The state of hospital, it's a bit alarming so much. Even if you go to
Especially
Mulago,
government.
of course, we have to do it in government. Our internship is only done in government hospitals, referrals and regional referrals, and a few, is it private or not for profit? These bigger hospitals, private, so they are in conjunction with the government. So even if you go to Mulago at the casualty ward, you can see how patients are just down on the surface and less health workers. In Uganda, we are having a ratio of 1 to 25,000 doctors to patient ratio.
1 to 25,000 means one doctor per 25,000 patients.
Yes. But the World Health Organization recommends 1 to 1,000. So even our seniors who are there, they are not enough. Now, removing the other 75% being done by the medical interns, it is enough to tell you that there is a total crisis. There is a total crisis. But people no longer care. These are people who are seated in offices, they get enough billions, they can manage getting health from abroad. From Italy, we see these government officials who die from Italy, who die from, USA and so on. But now, why don't they use that money they use for treatment there and they renovate Mulago? They bring better machines. Say that Mulago Hospital can work on this, on all the people of Ugandans, regardless of whether we are the minister, whether we are a peasant, and so on. So these are the people who have more than enough, and now it came to our mind that they no longer care about we, the common people. Yeah, because we see almost every venue, a big person dies. Treatment is on government, burial, etc.
But if you say that, I can ask you, still, like I had already asked you, where do you think the money should come from? Tell us and say, this year, limit the budget of maybe fuel for members of the August House and shift it to medical practitioners. Because like I've told you, the money is already budgeted for.
Yeah. Of course, they have to cut on different budgets. Recently, I was reading in newspapers and I found out that the speaker is almost getting, is it 1.5 or 2.5 for fuel every day? Yeah, there is a lot of money that is always allocated. It is too much. It is too much. Yet that small money, when you correct here and you correct here, it can help a resourceful ministry. You find priorities are being left out, and now these people, they are even adding themselves a lot of money.
Okay. Back to the state of hospitals. Have you been to some of them, or have you, as the people who are coming out to go to the media and make this noise, have you visited? Have you been on ground?
We've been there. Yes. We've been there. So whatever I'm talking about, at least I've seen and I've evidenced it. Yes. So
were these lists, you talked about lists that come out every year where they post you randomly. Were these lists worked on? Do you know that if the money is gotten tomorrow, do you know that I'm supposed to be in Nakapiripiri, the other I'm supposed to be in Rukunjiri? Were you given those lists, or is it stunted as well?
It is stunted, and it is only released by the Director General Minister of Health when everything is sorted. For him, he tells that I'll release this list when everything is sorted. So up to now, no one knows where we'll practice from. We don't know. We don't know. What you know that I'm waiting for medical intern. I don't know when and where. At least you know when and where waits. But now once we confirm when, then where will be so easy. So,
as a person who saw this issue of expired courses in the news, we know that medics can never be expired in any way. It is one of the professions that we need a lot. But would you advise somebody to go ahead and study medicine at this rate, yet even you who have studied, and other numbers that we cannot even count are still home lacking medical support, lacking support for medical practicing.
You know, the National Council, it used a wrong word to address these causes, which even actually it had to shame the education system of Uganda. Because you can't tell me that the course I did, it is expired, and when my university goes and gets accredited and they accredit it, then it becomes active. So they only use the wrong word to describe the crisis that is going on.
They actually changed and said,
and now they agreed to change it
due for review.
So right now, what I can tell you is one. Some of us, we had different dreams to become medics, regardless of whether pharmacist, whether nurse, whether doctor, but we had those dreams. But now, I can tell you that whatever is taking place, it is even, I'm just thinking about the young generations who are in secondary schools and they want to do PCB at the A level and they want to continue to do medicine, they want to do a bachelor's in nursing and so on. When they see the crisis that is taking place, I really see that their dreams are being shut down. Because you won't tell me that now I'll finish, then after wait for 2 years when I'm just fighting because I need to be deployed. So as a government also, they have to think about the future of Uganda. So whatever is happening today, it also affects us in the future. It's not actually, we are not happy that we are always on those streets, but we only go there because it is the only option left for us to save our future. We had different plans, maybe to get a scholarship, to go to masters and so on. Different job opportunities are just going on. They are passing every day. And time is just running. So, and for us, you can't upgrade without that license also. It's one thing you have to know. So as the government, maybe what I can end with is that they have to sincerely be strict and prioritize this. Ministry should also work on the budget for medical interns, because what brought to this is that they presented the budget and they had not included our budget in the bigger budget of the Ministry of Health.
So I want to understand, you said you can get the license only after studying, doing the 1 year, or can you get the license even without, can you pay some money to somewhere so that you get the practicing license?
It is impossible. The only road to get a license is an internship.
Okay.
That's why it is different from other professions. People have been coming up and saying, for us we do intern, we are not paid. But for you, you did it when you were in school. And me, I'm doing it when I'm a graduate. And when you were doing it somewhere, I was also in Mulago, in my clinical placement. I was there for 3 months also, and I was paying for it. So that's where the difference is. Whatever you did when you were in school, I also did it. So this is a professional thing, and for a graduate.
Okay.
Yeah.
Let's go to community. I'm sure that you have some of these friends of yours or colleagues that you know about. What's the situation? What are they doing now? Since they are not employed, they don't know what next, what is going on. Give us a picture of what's going on down there when it comes to the people. I
just wish you can get time and you go and cover up the stories of different medical interns. The frustrations and the depressions they are undergoing, it's totally heavier for them to hold. Some of them had some small paying jobs by March. But now when the ministry advertised for the internship, they had to forego that and applied, knowing that in 2 weeks, I'm going. Now they were repressed. They are now seated at home. Imagine you are a doctor, you're a graduate nurse, you're a pharmacist, and you are seated on the same village. Now you can analyze the situation that you still get the small money from the parent. Even you need airtime, even you need this and this, you have to dress up as, as an educated person. So if they can tell you what they are going through, the depression they are in, it can even make you run tears. We are just holding titles even, but there's nothing we can do. We're just holding titles only that.
You have seen these people? You've interacted with them?
I have interacted with very many.
Because Dr. Diana said there's a group that is the rich, there is the poor. The rich, I believe, are doing well.
I can only tell you that she is a total liar. Because she used an excuse that the parents of those who can manage went to the Ministry of Health. And they are the ones who suggested that. But these are our parents. Even if I'm rich, I'm above 18 years. I'm a graduate. Why should a parent again decide for me?
Sure.
Let us follow the law. She only used it I don't know whatever ball they are playing us, or whether they want to be in mafia game, I don't know, but just know that whatever Diana Twine said, it is total lies.
Okay.
It is total lies.
But the time is going. You people have sat since April. It is June, we are going to July, then August, and the year will be wrapped up. What next for you people? What next? Asking because I have already mentioned that what if the money does not come from anywhere? So what next for the 2,000 people that are at home? And we have also another group coming in, I think, completing
Exactly.
studies.
It's not it's not our concern, and we are not to be blamed for the time going. We all know the reasons for that. But of course, we shall not rest and we shall not sit down for that, because these are our rights. We shall have to advocate. We shall have to fight for them. And I can tell you that we are even having different plans. What if we're having plan A, B, and C? If this fails, we shall go to B. If B fails,
Give
then
us
C.
B and C lastly.
Some of them are just secrets, Yes, but
no,
now...
because these people can
like
only
Uganda,
watch you on the media.
I know. And even those who are watching me, they understand if they're medical interns. We are in touch with the Uganda Medical Association, the one that covers, it's the body that covers our seniors. They are also on our side. They are giving them some time. If it fails, then they'll call for the national strike for all the doctors.
Any last words?
Any last word I can say is that I want to first send my greetings to my parents, my beloved mom and dad, Mr. Kabiro Joffre, just down there in Kamwenge district. Then also to all my pre-medical interns, regardless of the frustrations we are going through, but we are putting God first, and we are hopeful that everything will go on well. As the ministry and the government, we are always keeping prayers that whatever they can do, let them do them in our favor. And we also get our licenses and we become professionals.
Okay. Like I said already, government has tabled national budget for 2023-2024, and we're seeing the country is going to be run on 52 trillion shillings. Now, the question being asked when it comes to the medical practitioners is, can 80 billion be got out of that 51 or 52 trillion Uganda shillings to make sure that we have interns going to do their 1 year, of course, practice and thereafter get their licenses? The conversation will continue on our social media platforms. That's at Church of Uganda Family TV on Facebook, Twitter, and some videos on YouTube. You ought not to miss the conversation. My name is Carol Tumwine. Thank you so much for being a part of Issues at Hand. See you tomorrow. Bye-bye.